Sharad Rajamani, consultant neurosurgeon from Manipal Hospitals Whitefield. I'm here to discuss the topic of intracranial aneurysms. Now, why did I choose this topic of aneurysms? Aneurysms are on the rise in India today. Traditionally, we have been taught that these aneurysms are seen in the Far East and amongst people from the northern part of Europe, Finland specifically. However, we are seeing more and more of these cases in India. And this has a lot of changes in the lifestyles of our people which have caused these aneurysms. Aneurysms are outpouchings of the blood vessels within the brain. They are balloon-like, and like balloons, as they keep expanding and becoming larger, they reach a point where they rupture or burst. When these burst, they extend, bleeding into the subarachnoid space, the space around the brain. Over time, a reaction develops of the blood vessels in the brain, causing spasm and strokes within the brain. This is very devastating. That is why we are trying to discuss this topic today. We can treat aneurysms by using a surgical technique, opening up the skull and putting a small clip to close off the neck of the aneurysm, or like they do in cardiac catheterization labs, pass a catheter straight up into the brain, and either we divert the flow of the blood vessel away from the aneurysm, or we fill the aneurysm with some material which will cause the aneurysm to clot. Either you can treat them when you detect them, or you can treat them after they rupture. The latter being much more dangerous, because even after you treat them, the reactions to the blood vessels can still produce strokes. And this is seen in about 85% of patients. People who are hypertensives, uncontrolled, those who consume alcohol as binges rather than daily consumptions, people who smoke cigarettes regularly, those with kidney disease causing kidney failure, and very rarely genetic causes. So basically, what I'm trying to say is we need to pick them up early and treat them. We use a technique called a CT angiogram, which takes about 15 minutes to set up and about 13 seconds to perform the test. It's very easy, quick, and we have very good results with this test. Those who are of the high-risk group need to be evaluated. Sudden thunderclap headache, severe in nature, associated with neck pain, and sometimes unconsciousness. So let's be careful, change our lifestyles, and we have to avoid certain lifestyle things which we perform. For example, smoking, binge alcoholism, etc. Thank you.